Hi, my name is Nergiz Turgut. I'm a clinical neuropsychologist and currently a professor in psychology at the Universidad San Francisco de Quito in Ecuador. I'm part of the Ecuador project, funded by the Center for Global Health Equity and in close partnership with Dr. Maria Music from the University of Michigan. Thank you very much for the opportunity to share this work with you. I grew up and received my clinical training in Germany. So during my master's degree, I completed an internship at a hospital and I went for it to Quito. So while it was a good hospital, I was deeply struck by the gap in resources, but also in access compared of what I had known in Europe. That experience fundamentally shaped how I think about health and equity. It made clear to me that addressing mental health without addressing the context and inequality is simply not enough. Ecuador focuses on maternal mental health in Bourbon, a rural coastal community in northern Ecuador, close to the Colombian border. Mothers in this region are raising their young children under conditions of chronic stress, poverty, and more recently, severe insecurity. What keeps me up at night right now is the current situation in Bourbon. There's drug-related violence, military presence, a constant fear that children may be drawn into or harmed by this conflict. Mothers worry not only about food and education, but about keeping their children alive and safe. So in this context, mental health is not abstract, no? So it's about survival, it's about resilience and daily functioning. Providing mothers with tools to cope, to connect with each other, and to feel supported is not optional. It's really urgent right now. So at this moment, we are at the very first step of the project, adapting well-established maternal mental health intervention, mom power, to the lived reality in Bourbon. So that means sitting together with the mothers in their homes, listening to their experiences, and learning what works and what doesn't, and what must change. So for many women, this is actually the first time anyone has asked them how they are doing as mothers and as people. What is unique about this CGHE-funded partnership is that the work is co-designed and it's locally led. So the adaptation is guided by the Ecuadorian field staff who know about the community and speak the language and understand the risks, and the decisions are made collaboratively, it's not imported. So the funding allowed us to slow down, to prioritize ethics, safety, and build trust, so which is essential in the setting like Bourbon. This project has already had an important impact. So it strengthened the local research capacity, trained field staff in qualitative methods and ethical practices, and also created safe spaces for reflection in a context where such spaces are rare. So it has already reinforced a sense of shared leadership between the institutions in Ecuador and the United States. Looking ahead, our vision is a community-based maternal mental health program that can be sustainably implemented in Bourbon and eventually also expanded across the coastal area of Ecuador, Esmeraldas. So if successful, this work could inform how maternal mental health is addressed in other high-risk, under-resourced settings like in Ecuador, but also beyond. So if this research were not supported, basically these voices would remain unheard. And interventions would continue to be applied without adaptation to local realities. So continued investment makes it possible to build programs that are culturally relevant, ethically grounded, and also owned by the community. What excites me the most about this partnership is that it recognizes mothers not just as recipients, of care, but as the backbone, of healthier, safer future generations, and build solutions with them, not just for them. Thank you to the CTHE for making this collaboration possible.